Okay, is it clear? Is it moving the
Ah,
screen?
yes.
Okay, that's good. Bismillahirrahmanirrahim. Number 18, during the Quality Management, Utilization Management Committee meeting of the Atlantic Medical Group, one physician takes the opportunity to express hostility over the contract health plans, performance measures, and practice guidelines, an issue not on this month's agenda nor pertinent to the meeting topics. The committee chair defers or delayed the complaint to the quality professional whose best response is to A, suggest that the issue be placed on next month's agenda, B, defer the health plan's right to measure and assess the quality of care provided to its members, C, express sympathy with the concerns and offer to discuss the issue in detail after the meeting, D, take this opportunity to educate the physician and committee about evidence-based practice and measuring performance. What's your answer, Radha?
Maybe we can say C.
Letter C, very good. Yes, this is the correct answer. This approach acknowledges the what physician's concern respectfully while maintaining the meeting's focus. For letter A, this is incorrect because this provides structure, but it may feel like dismissive or indifferent to the position, and it will delay the addressing their immediate concern. Well, letter B is wrong also because this one is undermines the health plan's role in quality assurance and could set a bad precedent, weakening the accountability measures. For letter D, this is informative, but this is not the right time. So it could derail, it will delay the meeting and appear confrontational, and it will make more problem to add to the tension. Okay?
Okay.
So letter C is the correct answer. Number 19, according to total quality management principles, managers must A, lead with autocratic decision making, B, lead with participative decision making, C, communicate successes or failures only to the boss, D, concentrate on short-term financial impact of quality improvement techniques. What's your
B.
answer?
Participative decision making.
Mashallah, very good, Ratha. Because this emphasizes involving employees at all levels in the decision making. Well, letter is incorrect because this contradicts the total quality management's collaborative approach. Well, letter C, this one, the total quality management requires an open communication with all the stakeholders, not just only the boss. For letter D, this is incorrect because TQM focusing on the long-term quality improvements. Yes, not just the short-term financial results. Okay, number 20. Okay. In keeping with the continuous quality improvement concepts, a three-pole role for the employee are customer, processor, supplier, means all except letter A, productive work is accomplished through processes. B, sound customer supplier relationships are necessary for sound quality management. C, uncontrollable variations in processes relate to differences in individuals. D, the main source of quality defects is problem incompetency. Okay, so what's your answer? For letter A, for letter A, this aligns with the CQI principles. So, which means that improving processes leads to better outcomes. So, yeah, this is correct, right?
Right.
Well, for letter B,
Sound
this stresses the importance of the strong relationship between the stakeholders to enhance quality. So, this is also correct. For letter C, so any variations that are considered as part of the system and addressed through a process improvement. So this is also correct. So the answer here,
D.
it's letter D. Okay, the main source of quality defects is problem incompetency because the CQI focuses on improving the processes, not blaming any individual competency as the main cause of quality defects. So that's the answer, letter D. Okay, number 21. The hospital medical staff and the governing board have been in conflict over increased medical staff representation on the board of directors for the last year. You are responsible for medical staff services, and the problem is affecting staff morale and productivity. What might you recommend to the CEO as the best way to resolve the conflict? A, table the resolution until the next board year when board membership changes. B, use a more formal negotiation process with a neutral facilitator. C, have the board chair send a firm letter to the chief of staff refusing to consider membership changes. D, have the CEO send a letter to the board chair suggesting expansion of membership to include all medical staff officers. What's your answer here?
B.
Yes, very good. Use a more formal negotiation process with the neutral facilitator. This is the best way to resolve any conflict.
Negotiation process.
Yes, as it ensures an unbiased approach. For letter A, okay, this is wrong because this one is delaying the issue that only prolongs the conflict. Well, letter C, this one is this is a confrontational and could worsen the tension between the medical staff and the board. While for letter D, this might come across as bias and could escalate the conflict instead of resolving it. So correct answer is letter B, use a more formal negotiation process with a neutral facilitator. Next, 22, the quality of patient care and the clinical performance of employed licensed individuals not permitted to practice independently must be reviewed. For these practitioners, relevant findings from organization performance improvement activities are considered. A, during the hiring process. B, during competency assessment. C, during survey readiness rounds. D, at time of licensure.
At time of hiring, or it is re-licensure?
During the hiring process,
Hiring
this
process.
also considered, but this is not the ongoing review needed
At
for
the
the
time of
quality.
re-licensure?
What's your final answer?
D.
Letter B, during competency assessment. Why? Because reviewing the clinical performance during this competency assessment, this ensures the licensed practitioners meet all the standards, supporting the quality improvement in the patient safety. For letter C, this is wrong. Incorrect readiness, because this focuses on the organizational compliance, not individual clinical performance. For letter D, this is incorrect because re-licensure is a periodic process and not directly tied to continuous quality improvement activities. For number 23, the best way to emphasize a point in a verbal presentation is to A, use repetition. B, use statistical data. C, raise your voice. D, use unique body language. What's your answer? Okay, it's letter A. Use repetition.
Repetition.
Yes, this is a proven, okay, a proven method for emphasizing key points in any verbal presentations. For letter B, use statistical data. This also supports point, but it doesn't inherently emphasize them. So raising your voice also can seem unprofessional or distracting. While for letter D, this enhances delivery, but is not the primary way to emphasize a point. 24, the implementation of mandatory educational programs for all staff handling any new biomedical equipment constitutes A, risk identification. B, risk analysis. C, risk avoidance. D, risk prevention.
Risk prevention.
Yes, very good. This is the correct answer because mandatory educational programs for staff handling new biomedical equipment proactively address potential risk. So by training the staff, the organizations prevent errors and mishandling, reducing the likelihood of incidents. Okay. Why it is not risk identification? Because this involves recognizing any potential risk. why not also risk analysis? Because this
Did not-
refers to evaluating the likelihood and the impact of risk, not taking action to prevent them. So letter C also is incorrect because eliminating the risk entirely, which is not the case here. Instead, the risk is managed through training.
Mm.
Okay, so it's clear. Number 25, teaching the use of quality improvement process tools is more effective when A, all possible tool options are covered, B, statistical process control is covered first, C, the team needing the tool is meeting together, D, watching a videotape. What's your answer?
Statistical process control is covered first.
What's your answer, Radha?
B.
Okay, B is statistical process control is covered first. So prioritizing one topic may not address the team's immediate need.
See, the team
Hi,
leading the.
Doc. Good
Hi.
evening.
Hello.
How are you?
Alhamdulillah, fine. Yes.
Alhamdulillah. Okay, so what's our answer?
The C.
Okay, the answer is letter C, Radha. Okay,
Okay.
why? Because these teaching process tools is more effective when the team needing the tool is present together, because this allows for collaborative learning, hands-on practice, and immediate application to real-world scenarios. For letter A, this is wrong because covering all options can overwhelm the learners and dilute the focus on relevant tools. For letter D, watching a videotape. This is also helpful, but this lacks interaction and real-time application. Okay, so which is very crucial for effective learning. So answer is letter C. Okay. Let's move on. 26. The first step in problem solving is to A, describe the worst case scenario. B, establish responsibility for change. C, collect and analyze data. D, define the problems and issue. First step.
Define the problems.
Yes, Mumtaz. Defining the problem is the essential, very first step in problem solving because it ensures that everyone understands the issue clearly, which forms the foundation for an effective solution. Why not letter A? Okay, because this is a what? Reactive approach and not part of the initial problem solving process. For letter B, assigning responsibility comes after, okay, when the problem is clearly defined. For letter C, collect and analyze data. This happens after the problem is also identified to support its understanding and resolution. Okay, clear? Number 27. Of the following options for problem solving, which should you do first? A, try to duplicate the problem. B, identify action options. C, collect and analyze the data. D, formulate an implementation plan.
Identify action options.
Okay,
Collect.
why?
uh,
What about you, Doctor?
Collect and analyze.
Yes.
Dr. Gulam, what's your answer?
Yeah, it's C what Arada said. Correct.
Collect and analyze.
Letter C?
Yeah.
Okay, the correct answer here is letter A.
Oh.
Why?
Duplicate.
Duplicating the problem is the first step to understand and verify the issue. Ensuring it is clearly observed and defined. And this helps in accurately identifying its causes and developing an appropriate solutions. B, this is incorrect. Identify action options because this comes after fully understanding the problem. For letter C, collect and analyze the data. This follows the verification of the problem. And letter D is incorrect because planning is done after identifying the root cause and potential solutions. So the answer is letter A. Okay. Number
Can I
20.
have the reason
Sorry.
for A? What is the reason exactly?
Okay. Duplicating the problem is the first step to understand and verify the issue. This ensures that it is clearly observed and defined. And this helps in accurately identifying the causes and developing an appropriate solutions. Try to duplicate the problem.
Okay.
Okay?
Okay.
For number 28, the best way to obtain the most information during an interview is to A, ask open-ended questions and let the other person set the pace. B, leave the office door open to alleviate possible tension. C, avoid eye contact to reduce the other person's nervousness. D, ask questions that elicit short responses to permit more questions.
Open-ended question.
Mumtaz, bravo. Because this encourages a detailed response, allowing the interviewer to gather more comprehensive information. Letter B is incorrect. This might cause distractions and reduce the focus of the interview. Avoiding the eye contact, the lack of eye contact can also hinder trust and engagement. While for letter D is short responses limit the depth, reducing the amount of any valuable information gathered. Okay. Number 29. Of the following, the most effective quality-based management of human resources involves A, hiring, training, appraising, firing. Letter B, hiring, retaining, promoting, appraising. C, hiring, training, appraising, promoting. D, hiring, training, appraising, employee relations. What's the answer?
D, hiring, training, appraising, and promoting.
Okay. Letter B, right? Your answer?
C,
Yes, that is correct answer. Hiring, retaining, promoting, and appraising. Because this focuses on maintaining a stable workforce by hiring the right talent, retaining them through engagement, promoting based on merit, and appraising performance to align with quality standards. For letter B, firing as a focus contradicts the goal of retaining and developing employees. For letter C, this overlooks retention, which is essential for maintaining the workforce stability. While for letter D is employee relations are important, but may not fully capture retention and promotion efforts, essentially for quality-based management. Number 30, community integrated delivery system is opening a freestanding ambulatory surgery center in 60 days. The person to develop the quality management program is being recruited within the IDS, or the integrated delivery system. Of those with the following qualifications, how would you hire? A, average quality management competence, but excellent interpersonal skills. B, exceptional quality management competence, but difficult in treating with physicians. C, excellent experience in quality management, utilization management, quiet and non-assertive. D, no experience, trainable, surgical nurse, knows the physicians. Of those of the quality qualification, following qualification, who would you hire? What's the answer? Any
A,
guess? Yes, the answer is letter A. The person leading the quality management, the QM program in this scenario needs a strong interpersonal skills to build relationships, especially with physicians and staff, okay, to ensure a successful program implementation. For letter B, poor interpersonal skills can hinder collaboration. Okay. For letter C, non-assertiveness. Okay, non-assertiveness here can be a barrier to what? Leadership, particularly in a fast-paced project requiring initiative and communication. What about the no experience? Trainable. So while knowing the physicians is helpful also, but the lack of quality management experience and the limited time, which is what, 60 days, so that is 3 months, make this candidate less ideal. Okay, clear? Okay. Number 31, based on your knowledge of motivational theory, which of the following would most attract a job candidate? A, job description. salary, benefits. B, job description, salary, and excellent working relationships. C, salary, benefits, and retirement plan. D, job description, salary, and opportunities to advance.
B. Job
What's-
description, salary, excellent working relationship.
Okay. Any other answer, Dr. Gulam?
Can be D.
Opportunities to advance.
Okay, yes, that is the answer. Job description, salary, and opportunities to advance. Why? Because according to the motivational theories such as Maslow's hierarchy of needs and Herzberg's two-factor theory, these opportunities for advancement fulfill higher level needs such as self-actualization and personal growth. So these factors are key to attracting ambitious candidates seeking for a long-term career development. For the job description for letter A, this is wrong because these address basic needs but lack elements of growth or long-term motivation. For letter B, this is also incorrect because positive relationships are important but do not strongly appeal to growth-oriented candidates. Letter C also is wrong. Retirement plans appeal to long-term security but may not motivate candidates seeking immediate opportunities for any development. Number 32, what is probably the most effective way to secure confidentiality among QM staff? A, good relationships among all quality management staff. B, department policy procedure within service. C, confidentiality agreement and department policy procedure. Letter D, confidentiality agreement with immediate dismissal clause. What's the answer? Okay, what is the most effective way to secure confidentiality? So the
B.
answer is letter B.
D.
D. Dog.
Okay.
Okay, because including an immediate dismissal clause in the confidentiality agreement emphasizes the seriousness of maintaining what? Confidentiality. So this creates
What
a
is
strong
immediate dismissal clause?
dismissal clause, including an immediate dismissal clause. Okay? Why not letter? Do you have any question?
Why not letter C?
Okay, why not letter B?
C.
Okay, why not letter C? This is also effective, but it lacks the strong enforcement.
Okay.
It lacks the for a strong enforcement mechanism provided by an immediate dismissal clause. So when we say a dismissal clause, this is a provision in a contract or agreement that outlines specific circumstances under which an employee can be terminated from their position. So it also specifies the conditions, the procedures or behaviors that may lead to dismissal, even without notice or additional benefits. Okay, so the letter A also is incorrect because relationships alone cannot enforce confidentiality. While for the letter B, policies and trainings are useful but may not be taken as seriously without strict enforcement. So the answer is letter B. Number 33, okay. Which of the following should not be part of performance appraisal? Okay, letter A, strengths and weaknesses. B, attitude and behavior with physicians. C, an off-duty incident witnessed by utilization management staff. And D, work disruptions with other staff. What's the answer?
Strength and weakness?
Okay, what's the answer? So the answer is letter C. Okay. Performance appraisals focus on job-related performance, behaviors, and contributions in the workplace. Off-duty, the off-duty here incident, okay, are not directly related to work performance. and should not be included unless they significantly impact the organization or violate the policies. So for letter A, the strengths and weaknesses, these are the core components of appraisals to help the employees grow and improve. Okay. For letter B, professional interactions and collaboration are critical to evaluate the workplace performance. While letter D, work disruptions.
This is during work.
Yeah, disruptions after teamwork affect the teamwork and the productivity. So making them relevant for appraisal. So the question here was should not be part of the performance appraisal. So it must be an off-duty incident witnessed by the staff. Okay, 34. To establish evidence-based practice guidelines, it is best to A, reply on subjective expert opinion. B, review every possible intervention or treatment. C, include those who resist process to decrease resistance. D, follow individual practitioner to make any exception to guideline. What's the answer?
Review every possible intervention.
Very good. Yes, this is the answer because this ensures that the guidelines are based on robust or strong evidence and best practices, improving patient care and outcomes. While letter A is incorrect because expert opinions can be biased or outdated and should be supplemented with an objective evidence. While letter C is also incorrect because this one, it does not ensure the quality or accuracy of the guidelines. So because there is an involvement resistant individuals that might reduce the opposition. For letter D also is incorrect because allowing unrestricted exceptions undermines the standardization and reliability of the evidence-based practice. So letter B is the correct answer. Number 35, operative other procedure review is the responsibility of A, the medical staff, B, organizational leader, C, the quality council, D, those providing the care and service. Okay. The medical staff, this one also oversee the clinical standards, but direct review is often delegated to those performing the procedures. So this is, we consider not the correct answer. B, the organization leaders. So leaders here provide guidance and resources, but do not perform the procedural reviews themselves, right? So letter C, what about letter C? The Quality Council focuses on what? Okay, oversight and policy rather than the operational review. So what's the answer left here is letter D, those providing the care and the service. Okay, so why? The answer is C, letter D, because these individuals directly involved in providing the care and performing procedures and responsible for reviewing their practices. And since they are in the best position to evaluate outcomes and ensure compliance with the established standards as part of continuous quality improvement. Okay, next number. 36. The data requested by the interdisciplinary team that was chartered for a clinic access improvement project has been defined, collected, aggregated, and displayed. The project has been coordinated by the quality professional for the system. The team is to make a report to the Quality Improvement Committee. Final analysis of data is next. Primary responsibility for that part of the process rests with the A, clinic physicians, B, quality professional, C, team, and D, quality improvement committee. What's the answer here? Final analysis of the data is next. So primary responsibility rests with who? With the
Quality committee.
Dr. Gulam, what's your answer?
Actually, it should be with the team.
Yes, you got it right. Okay, so the team is the primary responsible in the process. Okay. For letter A, they are also a valuable input, but the responsibility for data analysis lies with the entire team, not just in one group. Okay, so this is wrong. For quality professional, does not have primary responsibility for the analysis. For the quality improvement committee, this one, the QI committee reviews the findings and recommendation, but does not conduct the data analysis itself. So the team is the answer. Okay, number 37. Who is responsible for creating and monitoring the implementation of improvement project work plan and timeline? A, sponsor; B, team leader; C, team facilitator; D, quality council.
Team leader.
Very good, Radha. Yes, because the team leader is responsible in creating and monitoring the implementation of the project work plan and timeline, ensuring the tasks are assigned, progress is tracked, and the project stays on schedule. The sponsor here is incorrect because the sponsor does not directly manage the work plan and the timeline. While for the team facilitator, does not hold primary responsibility for the work plan. So this is incorrect. For letter D, the quality council oversees the projects at a higher level but does not manage specific timelines and work plans. Okay, so that ends the quiz of the people management. Any questions so far? Do you
Okay.
have any question?
No.
Okay.